Okay, so this question is in relation to diabetic ketoacidosis or ketoacidosis in general. Is it the same as HHS, which used to be called HONK, hyperosmolar non-ketotic state, HONKs? No, these are different. So HHS is generally seen in somebody who is has type 2 diabetes. And if we understand the fundamental difference between type 1 and type 2, the fundamental difference is that type 1s have no insulin. So they are hyperglycemic but no insulin. In type 2 diabetes and all of its related conditions, they have an abundance of insulin. They're insulin resistant. So because they're insulin resistant, what that's going to do is that's going to cause a person to have an accumulation or a trigger for making more insulin. So in type 2 diabetes, often there is a surplus circulating insulin concentration. Now, when insulin levels are high, like in a patient with type 2 diabetes, but they're insulin resistant, in other words, their tissues are resistant to that insulin, of course, we're going to start to see an accumulation of glucose. Cells are not getting fed because insulin is resistant. It's not facilitating the transport of glucose into tissue. And so now the cells are starving and blood sugar level continues to rise. Now, why don't they break down fat like somebody with type 1 diabetes? And that's because fat cells will not release their free fatty acids unless insulin levels drop. Remember, insulin is a fat growth hormone. In the presence of insulin, then fat's not going to release its free fatty acids that ultimately are converted and turned into ketones in the liver. So remember the pathway? Fat cells release free fatty acids, that goes to the liver, beta oxidation converts those free fatty acids into ketones, ketoacidosis. That can only happen when insulin levels are low. In type 2 diabetes, the insulin levels aren't low. The insulin levels are high, so they can't break down fat, they can't make ketones. So they become hyperglycemic, which makes their blood very, very hyperosmolar, and that's called hyperglycemic hyperosmolar state. We have to fluid resuscitate these guys. Bring down their sugar, so their blood's not so hyperosmotic. Target is to bring their osmolality down below about 295, so 285 to 295 is the normal milliosmoles. You'll want to be targeting fluid resuscitation to bring down that osmotic blood. They're dehydrating to death, these guys. Remember, glucose isn't killing them, it's the dehydration.